This clip is sponsored by American Mobile. If you're a nurse interested in traveling, visit americanmobile.com to get started. One of your points is discernment regarding interventions and just being intentional, about the things that you're doing, and being okay with saying or taking off your hat of, this is the policy of my hospital. This is, and kind of figuring out how can I be an advocate for this person, and what does that look like within the confines of the hospital,
Mm-hmm. Yeah. And this is very interesting and tricky and without it's I'm like, how I don't want to maybe say everything that I'm thinking here, but I guess what I do want to say here is that it can be really helpful to get really clear on the rationale for different interventions when we're caring for someone who's dying. And again, to reflect back to that creed of first do no harm. So, which means before I do something that may have a negative impact on this person, and this person has, these goals for their care, which is they want to have the most peaceful and dignified and consensual experience with death possible. Okay, so I'm coming in this room because I'm supposed to check their vital signs and I'm supposed to reposition them. So really doing that work of trusting, centering, and attuning allows me to think critically from that grounded place of, okay, so repositioning this person, repositioning them every 2 hours is meant to promote skin integrity, to make sure that their skin stays intact. Now, is intact skin integrity really an appropriate goal for someone who is actively dying?
Right. No.
No, it's not. But what is an appropriate goal for someone who's actively dying is sleep, being comfortable. And so perhaps rather than repositioning them every 2 hours, I can walk in and attune to them and even observe, do they look uncomfortable? Or do they look calm? Is their brow furrowed? Are they sweating? And then maybe I do want to go ahead and do some gentle repositioning. And it doesn't have to be a full, like, we're getting in there and we're like,
right,
heaving them up in bed as high as we possibly can. But maybe then we're just like gently sliding pillows. Maybe we're getting an extra set of hands, someone who can really hold that person in a very gentle and loving way while we, scoot a fresh bed sheet underneath of them or something along these lines. But yeah, just really fine tuning those interventions.
Yeah. And having just the focus always go back to what the patient needs as opposed to what you are used to doing, because, certain interventions that are geared towards healing, that's not a goal anymore. Like the goal is to, keep them comfortable. And so, if that's, turning every 2 hours, and I really, that's one of these points that I think hits home the most in the sense that, ways that we need to rethink the way that we do things in the hospital is just making sure that you're aware of the interventions that you're doing and why you're doing them, and just, attuning all of those interventions specifically to what the patient needs rather than what you are doing for your other patients.